Hi, I'm Henry Acosta, and you're listening to Health Professional Radio. Today we have Dorothy Kamaker. After working 30 plus years as an intensive care and emergency nurse clinician, she decided to start a company that helps patients get the best outcomes out of their treatment. She is the founder of Patient Advocate Australia. Today we're here to talk about her company, what they do, and how they provide their services. Hi, Dorothy. Thanks for coming on the show. We're glad to have you here.
Yeah, good morning. Thank you very much.
Awesome, man. How are you doing today?
Yeah, fine, thanks, fine. Yep, all good here.
And can you tell us a little bit more about yourself?
Yeah, working 35 years as an ICU nurse and academic at the University of Sydney. And I recently retired from intensive care nursing and qualified as an independent patient advocate. And in 2014, at the beginning of 2014, I set up a practice working as an independent patient advocate in Sydney. And I also took on then a partner a little bit later than that, and together we have a fairly broad base in the healthcare system. My background is largely in acute care, so patients who've got new diagnoses or acute health problems, and my partner works in that area to some extent, and also in the disability area and aged care.
And can you tell us about what is Patient Advocate Australia, what you do and where you do it?
Sure. It's Patient Advocates with an S.
Mm-hmm.
And we work from Sydney. We have three bases. I have offices on the northern beaches and in the CBD in Sydney, and my partner works from the inner west. And what we do is work in the private sector to support and advocate people in the general and the aged care systems. And it's a paid service. That said, I do a lot of pro bono work. I lecture at community colleges and to healthcare students, and I run free seminars for councils and for groups like Probus or social clubs, where I teach people to be effective themselves as their own advocates in the health field. But what we do is we support people who need pretty much any kind of healthcare support, or we advocate for them if they want their healthcare improved. I think the single commonest request that I get from patients is that they say, look, I need help. I've just been referred to a specialist, and I really would like to have somebody by my side who, with some expertise, who has trained ears in the healthcare system and who can ask the questions that I wouldn't know to ask, who can take notes, and then afterwards who could help me understand what I've been told and to make the decisions that I'm going to have to make, and then to translate everything for my family and send me a report so that I can discuss all of this with my family. Or I also get referrals from healthcare professionals, and then they're more likely to say, look, I have a patient who needs some short-term assistance with whatever it is, with XXX. Most recently, that was a patient who'd had a new cancer diagnosis, and the specialist thought that that patient might need someone to go along to the specialist, to the consultation, so that she would not, she wouldn't spin out really, so that she would have somebody there taking notes and understand everything that was being said. So that's largely what we do. Doctors and nurses and family members usually know when a patient would do better with somebody by their side who can be with them over a longer term and support them. So often we get referrals from family members. Often that is a matter of them finding us on the internet, or some of my past clients sort of speak about us to their friends and relatives, and so we often get word-of-mouth referrals. But we get referrals from GPs, we get referrals from health specialists, and More recently, we've been invited to collaborate with a couple of medical centres, with a couple of hospitals, and with a couple of cancer providers, cancer healthcare providers. And so we're getting referrals from those for people that they feel are possibly having trouble understanding their treatment or coping with the decisions they have to make, or that they feel that they may not be complying terribly well with their management, or in some instances that they feel that the patients are wavering in their adherence with maybe giving up their management. So it's sometimes it's 90% a matter of communication, and a lot of, if you're very experienced in the healthcare system, then you know the language, you understand the culture of healthcare. You're not intimidated by doctors or by nurses or by being in a hospital, and commonly patients are intimidated by those situations. So, and you're not emotionally involved, so you tend to be able to be neutral. Often patients take family members along to advocate for them, but that's more useful for emotional and practical support. But it's very rare to find a family relative or friend who's adequately health literate, or who is consistently available across all venues. You know, they're not working, or they're not interstate, or they're not somehow otherwise got a call on their time. And often those people are not emotionally neutral. So there are horses for courses. If you want somebody who can give you some sort of expert support, then it's best to go to somebody who is well trained in that area and who's qualified in that area. So I think patients' families are absolutely invaluable, but I don't think that there is often a crossover between what people expect of family members, and I think that my experience is sometimes it's best to get an emotional advocate or supporter, and then somebody who is health trained. And so that's largely what we do. We provide that kind of expertise so that people don't add, if you like, almost, you know, two groups of people who don't understand what's going on. It's like the blind leading the blind sometimes. It's not useful to have somebody who doesn't understand the healthcare system in there as an advocate. It's useful to have them in there doing what they're good doing, which is supporting you emotionally or practically.
Wow, and very admirable work you guys are doing.
Quite often too, just to add to that, we get requests from family members or from patients whose family lives out of town, out of Sydney, so based in the country, or with children living in Melbourne or overseas. And I've had multiple calls recently, someone who lived in Seattle and who wanted help for his mother who was having surgery, and someone who lived in Melbourne, and just all over the state, someone who lived in Gilgandra and their mother was having surgery down in Sydney. So we often provide the communication and the link for those people to their families and with the providers, with the doctors and the hospitals. Yeah, so, you know, we do just about anything in the healthcare system where a patient thinks that it would be a good idea, or a doctor or a nurse, that this person had a bit of support.
And I'm wondering what inspired you into starting Patient Advocates Australia?
Look, I was working in ICU up until 2013 when I started this business, and in the emergency department, and I just kept seeing patients who the staff, or mostly the staff, would say, oh my God, you know, they're just not going to cope, or, you know, I just don't think they've understood what we've said, or I need to get a decision from this person about whether or not it's appropriate to go to surgery, or what would they want for their mother or for their sister or brother. And the staff themselves, I was in this position often where I thought, gosh, with better support, these people would make better decisions. They would be less stressed. They would feel more confident with the treatment that they opt to accept, and they would have somebody who they've made contact with who they could then move through the various stages of management with. So, for argument's sake, somebody who's had a stroke might choose to have their parent transferred to a stroke intervention unit. That person might go ahead and have a procedure to unblock that clot. They might then go on to require rehabilitation hospital, and then they may need further support when they get home. And I am with the client all the way through those various stages so that I can help them to make the decision about whether or not to go with the clot busting, or same thing applies to coronary angiography and stents. Same thing applies to just about anything. So the idea is that when you engage an independent patient advocate, then they are there when you want to utilise them all the way through the whole healthcare issue. You can utilise them for as little as a few hours, or you can just call on them as you need it. So it's the thing that inspired me was seeing who would have had much better outcomes who really just didn't get that support. And the other thing that was absolutely clear and is a really well-known fact with health carers is that when you do have a patient who's got a relative who's in the healthcare industry, a doctor or a nurse, their outcomes are way better. And, that's well known. And it seems, seeing as not everybody can have a healthcare worker in their family, they can do that if they just engage one. There's no need to sort of rely on inexpert support and help. You can just go out and engage one. So the things that made me inspired to do it were those, were just seeing how often patients could have much better results. And I had the same experience with my mother. My mother had a critical illness, and in a major teaching hospital in Sydney, and we realised that she was being treated within the constraints of the healthcare system rather than for her own best interests. So I can't tell you the number of times I heard people say, oh, look, she's 80. And then we realised that the care was being calibrated to that particular variable. And, they really didn't have any idea that she was a superb 80, and that, so I had to sort of advocate for her, and it made an enormous difference to her outcome. It just made a huge difference. I ended up having her transferred to another facility where she was treated quite differently. And so, they're the sort of things that it inspired me to do patient advocacy. It's a fantastic career. It is just so rewarding.
Well, thanks for sharing your story. It sounds amazing.
The people who benefit from it are the patients and the families primarily. But what I'm finding is that the specialists themselves are very interested in getting somebody on board to help their patients. Although I'm always engaged by the patient, it's often the specialists who realise that the patient would do better. And the profession itself is only 4 years old in Australia. So my big interest is in familiarising health professionals with the service so that they can add it to their patient management options, so that what they can do is say to the patients, look, I'm not suggesting that you necessarily engage a patient advocate, but you should understand that there is that help out there if you would like it. And so here is the sort of person, and if patients just Google patient advocate, they will find patient advocates there. But one of the problems really is that the healthcare system itself has moved into a much more intensive and higher acuity system, and the support services are just catching up with that, and patient advocacy is one of those support services. So for me, my interest is in getting the healthcare providers to know that the system exists so that they can make it an option for their patients. And at the moment, I'm working at several hospitals and in several medical centres, and now that those medicos and nurses know that such a service exists, it's amazing how often they make contact, or it's actually the client that usually makes contact. And the client, sometimes, I can just straighten the client out with a bit of advice over the phone about how they might go about solving their problems. But, the patients themselves are incredibly grateful. They very often say, my goodness, I had no idea that I could, get this support. It was just that the doctor said to me, look, you could get somebody to help you through this first stage. And so now, I'm finding that the doctors themselves are getting some good feedback because they have.
Can you tell us what's the biggest misconception that your clients and you as a business owner usually get about your services? It usually just drives you nuts.
Well, I guess the two biggest issues are awareness. I find that people are just not aware of the service, so that's one issue. It's not a misconception, it's just that it's a new service. It's only been around for about 4 or 5 years in Australia. It's big in the States and it's becoming established in the UK, but so perhaps not so much a misconception, but just that it's not, people are not aware of it. But I think also there's this, well, we've always done it this way, let's muddle through, let's see if we can just get by. And this is an issue even when patients or medicos or nurses know about it and they say, well, this is new, do we really want to try this? When in fact most of those people would say with expert support the outcomes would be better. I did a survey, and of the 350 people I surveyed, about 90% said that they thought it was a vital or important service, and several of those, I can't remember how many, I think around about 20 or 30 were health professionals, and they believed that it would be really a valuable service. And about 78% of that group said that they felt it was something that they would pay for in order to access if it was likely to lead to better health outcomes. So, I think that people tend to be a little bit resistant to take on new options and to change, but the evidence is there that people with excellent support and with an advocate at their side do have better health outcomes. So, that perhaps is one of the things that make me sort of stay awake at night, as you say, just thinking about how do I make it clear that this would be an option that works for people. So, it's really just giving the patients themselves the choice. I mean, there is a bit of a tendency to be a bit controlling about what information health providers hand out, but if they just make the patients aware that the service exists, then the patients themselves can just make that choice.
And for our last question, what's the best way to get in touch with you guys and maybe help out other health professionals know about patient advocates so they can get your services? Yeah, look, anybody can call me on 0421 011 430, and we provide a free evaluation by phone. So we will just listen and give some advice. So whether that's a nurse, a doctor, or a patient, or somebody who knows of somebody who's unwell, we're very happy just to listen and appraise that particular story and give them some advice. We don't give any healthcare. We don't deliver any healthcare. We don't give any healthcare advice.
but we sometimes can give advice about how to navigate a system, which, just requires something, on the phone, and we don't charge for that. But the best way for people to contact us is definitely to do that, or to go to our website, which is www.patientadvocates.com.au, patientadvocates with an s.com.au.
Awesome. Well, really admire your work, Dorothy, and thank you for coming on the show. We appreciate your time.
Thanks very much. Lovely to chat.
And that was Dorothy Kamaker, founder of Patient Advocates Australia. If you want to get in touch with her, you can go on their website, www.patientadvocates.com.au. That's PATIENTADVOCATES.com.au. And they'll be very glad to listen to you and know more about your needs as a patient. We just finished talking about Patient Advocates Australia and how they're improving a lot of people's lives. If you want more interviews related to this, and if you want to find transcripts and archives, you can go on www.hpr.fm. We're also available on SoundCloud and iTunes. I'm Henry Acosta, reporting to you for Health Professional Radio.